Hello everyone. How's everyone doing? It's Dr. Nicole, your board certified family physician. I specialize in managing and treating chronic medical conditions and educating everyday people about those conditions in terms they can understand. Through my books, my seminars, my concierge medical practice, I help pastors and everyday people live their best lives by transforming their mind, body, and spirit so that they can be better informed and impact their communities, their congregations, and their families. Please follow me on Facebook at www.facebook.com/Dr. Nicole D.O. That's DRNICOLEDO. Now, today I look a little bit different. I am Dr. McStuffins in the flesh. We are going to talk today about pediatric wellness exams. So, it's time for your checkup. I'm going to wait just a few more moments, let some folks join in. If you join in, please leave your name or a message in the comments so that I know you're here, all right? Let's just listen to a little doc while we're waiting.
My vet's coaching back. You got it, Doc. To find out what's wrong, I need to give your goats a checkup. Time for your checkup, time for your checkup. I'm gonna check your ears, check your eyes, find out how much you've grown. Time for your checkup. I'm gonna listen to your heartbeat, fix you up, ready to go. Time for your checkup. It's okay if you giggle. This will only tickle a little. Time for your checkup, time for your checkup.
Oh no! I can't feel my toes!
I love Doc.
You don't have toes, Chili.
She's so cute.
No, this is cool!
All right. Well, let's go ahead and get started. Like I said, I'm Dr. Nicole, and we're going to talk today about pediatric wellness exams. Hey there, thanks for joining in. Appreciate it. All right, so wellness exams. Why do we do them? Like we talked about yesterday, we do wellness exams for anyone and everyone from all ages, from the womb, I say, to the tomb. Okay, so all ages need a wellness exam. And how often you go for your wellness exam just varies depending on your age and depending on what medical conditions you have. But we need to at least see you at least once a year. Now, like I said, it does start from the womb. So ladies, when you're pregnant, you need to be going for your prenatal exams. Okay, those are wellness checks as well. Why do we do wellness checks? In general, and we discussed this yesterday, please go to my Facebook page, Dr. Nicole D.O., www.facebook.com/Dr. Nicole D.O., and you can check out the video from August 26th where we discussed wellness exams in general. So why do we do wellness exams? We do wellness exams for preventive measures. We want to prevent diseases before they occur. So there's three types of prevention. There's primary prevention, there is secondary prevention, and there's tertiary prevention. With the primary prevention, we are fixing medical problems before they even exist. So that's like giving immunizations so we can prevent and totally get rid of medical conditions before they even start to be a problem, all right? Secondary prevention is where you are finding risk factors and then modifying those risk factors to prevent the disease from occurring. So things like high blood pressure, obesity, cervical cancer, diabetes, these are some of the conditions that we can do secondary prevention for. And then tertiary prevention is when you already have a medical condition and we're trying to prevent it from getting any worse. So, like I said, everyone needs a wellness exam. Hey, Crystal, thanks for joining in. Everyone needs a wellness exam from the womb to the tomb. So let's talk about babies. So like I said, ladies, when you're pregnant, you need to be getting your wellness exams as well. Even prenatal exams, those are wellness exams. You need to be taking your prenatal vitamin. Even, and let me just say, ladies of any childbearing age, you need to be taking a prenatal vitamin every day because that can help to prevent neural tube defects, things like spina bifida and problems with the spinal cord before the babies are even born, before you most of the time even know that you're pregnant. So you need to be taking a prenatal vitamin that has folic acid in it every day. All right, so once you're pregnant, you're going for your prenatal exams after you have the baby. Once you have the baby, whether that's a vaginal delivery or through C-section, the doctor will do the first wellness exam on the baby at the time of the birth. So what we do at that time, we go through a full exam on the baby. We're going to check their scalp, their soft spot. We call that a fontanelle. It's called, you know it as a soft spot. We check that to make sure it's not bulging. We're going to check their eyes and make sure that they have what's called a red reflex, which means when we look in the eye, we need to see something flashing, almost like a red light flashing back at us that lets us know that the retina is intact. We're going to check, of course, their ears. We're going to check their nose, their mouth. We're going to check their clavicles, their collarbones to make sure that there is no fractures during the delivery. We're listening to their heart and their lungs to make sure that everything sounds good. You see my Doc McStuffin's stethoscope, but we're going to use the stethoscope, listen to the heart and the lungs. We're going to check their bellies, make sure that we can hear digestive sounds in their bellies. We check their hips. A lot of times you'll see, I'm just going to borrow one of the dolls here. What we'll do is we take the hips and we roll the hips back and forth to make sure that there's no what's called hip dysplasia, that the hips are correctly developed. We're going to check reflexes. Yes, even babies have reflexes. They have what's called a Babinski reflex. We check and make sure that their toes flex backwards. So we check all these things on a newborn baby, all right? So day of life, that's your first wellness exam, all right, for the babies. At that time, we're also giving immunizations. At that time, we give the hepatitis, medication, the immunizations to help prevent diseases that could have been processed or passed through the delivery. All right, things like we put medication on the eyes, like gentamicin, to prevent disease to get into the eyes. All right, so we also do a hearing screen at birth to make sure that the hearing is intact. So there's all kind of screening tests that we can do as a newborn. So after you take your baby home, everything's going great, we usually have you come back anywhere between 1 to 2 weeks for a weight check. Most babies, if not all babies, will lose some weight from their birth weight in the first 10 days of life. So we want to see you back usually within 1 to 2 weeks to make sure that you have regained your birth weight, okay? So moms, don't be concerned, and dads, don't be concerned when they lose a couple pounds those first couple of days. If you come back at the 1 week visit and they've lost some weight, we expect that, all right? But when they come back again in the 2 week visit or at the month visit, they should have regained their birth weight. Usually within 10 to 14 days, they have regained their birth weight. All right, so at that 2 week appointment, we're going to do the same head to toe exam. We're looking for any abnormalities of the kids, of the babies at that time. And then, so we're going to do at birth, we're going to do sometimes a 1 week or 2 week visit. And then we're going to do a 1 month visit, and then 2 months, 4 months, 6 months, 9 months, 12 months, 15 months, 18 months, 24 months, and then every year thereafter. I know it's a lot, but at each one of those appointments, we're going to do different things, and we're looking for different things developmentally to make sure that things are moving along as they're supposed to, all right? So what are the things that we do at each of those? Hey, Dr. Shanika, how are you? Thanks for joining in. What are some of the things that we do at those appointments? Well, we're looking for, like I said, we're going to do a physical exam at each of those appointments. So we're going to make sure that physically the baby is developing well. We're going to check head to toe at every single appointment, okay? And then we're going to check developmentally. We're going to make sure that they're hitting developmental milestones. I like to let my parents know that, yes, we are testing for developmental milestones, but just because your child is not necessarily meeting those milestones doesn't mean it's something that you need to be alarmed about, all right? I get a lot of moms that are like, oh my gosh, my 2-year-old isn't jumping yet. And I was like, well, okay, give them a little time. Each child is a little bit different. But in general, we do have some developmental milestones that we're looking for. For example, let's go through just a couple of them. And we'll just take a toddler, for example, because that's a good age where they're already starting to do stuff. A toddler should be able to kick or throw a ball by 12 months. They should be pushing and pulling objects. They should be climbing up on things. We know anywhere between 12 and 24 months, those little bugaboos like to crawl, right? They like to crawl up on things and climb on things. Between 18 and 24 months, they're starting to run. We know that they can, don't be surprised if your child's not able to jump with both feet leaving the floor before 24 to 36 months. That's not, that's something that developmentally they're not able to do until they're about 2 years old. You'll see them kind of maybe hop up and down, but in terms of both feet leaving the floor, that happens later on in development. All right, so we're going to hit those developmental milestones at the wellness exam, and then we're going to do what's called anticipatory guidance. That is where we, the doctors, and the psychologists and people who have developed these milestones over the years, we anticipate some things that should be happening in your child's life. So some anticipatory guidance. For instance, we'll let you know that around 4 months, when you come for your 4-month visit, that it's time for your child to be rolling over. All right, so we're going to let you know, okay, baby's going to start rolling over, so at this time, make sure that you're not leaving baby on someplace high like a changing table or on a bed where they can roll and fall off onto the floor. All right, so because we have anticipated what could happen, that can make you more aware of how to keep baby safe. All right, so anticipating things like anticipatory guidance, like when they roll, or when they should start sitting up, when they should start babbling or talking or making noises, when they should start saying mama, dada, when they should start eating table food. So typically we say that around between 4 and 6 months, you can start introducing one new type of table food per week, typically, so that we can make sure that they're not having a reaction to the food. But we're going to go over all of these things at these appointments. I try to stress to my patients the importance of coming to each of these appointments, because we're going to discuss something different at each time. Like I said, we're going to do a head-to-toe exam, but believe you me, on a baby, those go pretty quick, the exam portion. What takes up most of the time of the visit is the anticipatory guidance and the developmental milestones. We even have things like in my office, I have some blocks, I have some paper and pens, because I want to see the kids, I want to see them write. You know, when they get old enough, I want to make sure that they can write. I want to make sure that they can stack some blocks. I want to make sure that they can run, that they can stand on one foot, that they can jump up and down. Because these are the things that if they can't do these, this might be where we need to do a referral to a developmental specialist. All right. So also at the exam, we check all kinds of different screenings. So some of the screens that we do for autism spectrum disorder. We will do screenings for, like I said, their development. We do screenings for psychosocial or behavioral. So we're going to start at, we ask kids about depression. We ask kids about anxiety. We ask kids about bullying. We ask kids about, are you happy? Do you have friends? Are they more of a loner? Are they more of, interacting with others a lot? So we can get that information, and we can help to find problems before they exist, if there are any problems. This is also why I've encouraged parents to find one provider to stay with, because that provider then learns your child and knows your child and can know sometimes early on if something is different, because they know your child. They know what's going on with the child, okay? Some of the other screens that we do, of course, as the child gets older, we're going to start screening for, like I said, autism, depression, and then tobacco, alcohol, and drug use. We do know that children and early adolescents, preteens, can have peer pressure, so we discuss that. Now, parents, I do like to bring this up. As your children get older, usually in the preteen to teenage years, we do ask that you step out of the room for a portion of the exam. That's because sometimes kids don't want to talk, or teens don't want to talk so much in front of the parents. So, of course, for your 6 and 7 and 8-year-olds, we're not going to ask you to step out for those. But for your older children, your teenagers, your preteens, we ask you to step out of the room so that we can have a candid one-on-one conversation with the teenager or with the preteen. They might be a little bit more prone to opening up to us if mom or dad's not in the room. Don't be offended. Just know that we're doing that with the best interest of your child and your teenager in mind. All right, so what are some other things that we do at the wellness exam for children, toddlers, adolescents, young people in general? We're going to do, if needed, we're going to do some lab work. We want to check things like lead screening. We want to check a hemoglobin to make sure that they're not anemic. If you have things like well water, there's certain things that we can test for to make sure that there's no parasites or anything that could be brewing from your environment. Because of that, we also do kind of a home screening. So we ask about things like, do you have well water or city water? Do you have guns in the home? Are they locked up? Or do you have a safe? We ask about bicycle helmets. We ask about the knee pads and the elbow pads. We ask about the safety precautions. Are they wearing their seat belts? Are they still rear facing in the car until they're over 2 years of age or until they're over 36 pounds? 40 pounds, excuse me. So we're going to be doing safety measures because we want to prevent diseases and we want to prevent accidents from happening. All right. And then we're also going to start discussing, we do a vision screen. So we want to check their vision, make sure that they're seeing okay. We also want to check their dental, make sure that they have gone to see the dentist. Okay. Typically, you need to see your dentist between 1 and 2 years old. That first appointment is usually just to get comfortable with the dentist so that they're used to seeing a dentist. They might give them a toothbrush, a toddler-safe toothbrush, and then some special toothpaste without the fluoride in it, okay? So it's a lot of stuff that we do at the children's wellness exam, all right? Adolescents, we're going to talk a little bit more in general, specifically about adolescents on Friday afternoon at 6 p.m., but we do a lot at the children's wellness exams. So let me just go through one more time when you should bring your kids in for the exam. At birth, usually 1 to 2 weeks, 2 months, 4 months, 6 months, 9 months, 12 months, 15 months, 18 months, 24 months, and then each year thereafter, all right? One last thing that we do for the pediatric wellness exams is to make sure that you have your immunizations, all right? For the immunizations, we're providing immunizations on a schedule, typically, and fighting things like against polio, against diphtheria, which is whooping cough, against hepatitis B, against, hey Superior, thanks for joining in, against varicella, also known as chickenpox, which later on can prevent shingles. So we're going to give immunization schedule. Now I know that some parents, thank you sir, some parents choose to do a delayed immunization schedule, and I really recommend that you speak with your pediatrician about that, and so that you can be sure that you are on schedule with vaccinations for your child, okay? So that's the last thing we do at the wellness exam. So please bring your children in for their wellness exams on time, if possible. Try to set it around that milestone. So if they were born on the 7th, try and do, the 7th when they're 2 months old, the 7th when they're 4 months old. They'll give you that appointment. So try and stay up to date with those appointments, and that way we can prevent medical issues and diseases from occurring. We can also prevent, yes, I'm Doc McStuffins. We can also prevent accidents, and we do safety and wellness prevention, all right? So, again, I'm Dr. Nicole, your board-certified family physician. I specialize in treating and preventing chronic medical conditions and explaining those conditions to people in everyday terms, so that they can have a good understanding of those conditions. Through my books, my webinars, my concierge medical practice, I help pastors and everyday people live their best lives by transforming their mind, body, and spirit so that they can impact those around them, their congregations, their families, their communities. All right. Thank you so much for joining me again today. I hope that you learned a lot about pediatric wellness exams, and I hope that you will join me tomorrow, same place, 6 p.m. We're going to talk about health exams, wellness exams for men. All right. And believe me, I'm not going to dress up like a dude tomorrow. I just dressed up like a Doc McStuffins today. But join me here, www.facebook.com/Dr. Nicole D.O. That's DRNICOLEDO. Please share this video. Please invite your friends to join me tomorrow as we're going to talk about men's wellness exams. Thank you so much for coming, and remember, everyone, go and schedule those checkups for yourself and for your children. It's time for your checkup. Bye-bye.